discussing challenges, opportunities for digital healthcare in hospitals, how DayToDay has helped hospitals improve patient care through digital platform, research opportunities in the area of digital health, and role of AI and data science. In addition, we'll be talking about what skill sets are required to make a career in digital health. For those who are new to web series by IIHMR, I would like to give you a brief profile of IIHMR. IIHMR is a research-focused management university having 35 years of excellence. It was established in 1984. The programs that we offer are MBA and MPH. MPH we offer in collaboration with JHU USA. We are among top 100 universities in India and the cleanest university, which is award which was awarded by Ministry of HRD. DayToDay is a global health tech company, and it works in the area of personalized healthcare solutions, and it is based in Boston. We have honor to have Dr. S.D. Gupta, sir, who is chairman of IIHMR University. He is a distinguished public health professional with more than 4 decades of research and academic career. He has a PhD from Johns Hopkins University. He is also a fellow of Academy of Medical Science and an adjunct professor at Johns Hopkins University. He is one of the pioneers of public health management in India, and he has done more than 100 research studies and projects in collaboration with international and national organizations. Sir, I invite you to express your views on digital healthcare transformation in hospitals, and many thanks for accepting our invite.
Thank you, Shweta, and I'd like to thank all the eminent speakers in this webinar and welcome all the participants in this important webinar on digital healthcare transformation in India in hospitals. As you might be aware, India's health sector is one of the largest health sector. And if you go by what we are, it's going to be $280 billion healthcare industry by 2020, by this year. And it's growing at the rate of 16 to 17%. We in India have about 1.6 million hospital beds, of which 700,000 beds are in the public sector and remaining 9 lakh or 900,000 beds in the private sector. So it's important to see the contribution of the private sector in hospital care in India. Indian healthcare, besides that, the public health systems that we have over 200,000 health and wellness centers across the country and over 30,000 community health centers. So huge infrastructure that we have in India. It was very important for India. And in addition to the health sector, I include pharmaceutical industry, which is growing at 16% CAGR. So huge infrastructure, huge resources, huge human resources, and huge turnover of patients. And what is happening in India is this is going through epidemiologic and demographic transition. So as a result, what is happening, the population is aging and our healthcare needs are changing. So more of elderly people coming in and more of non-communicable diseases coming up. So almost 70% of the disease burden in India is because of NCDs like diabetes, hypertension, cardiovascular diseases, COPDs, and injuries, road traffic accidents. So it is totally reversed what it was. So our healthcare needs have also changed. But we all know that what has happened very recently in last 4 months, we are struggling with a new virus that has affected the whole world in the form of a pandemic. You all know that the number of deaths it has caused is around 350,000 around the world. And most of, I would say about 25% of the total deaths have occurred in United States, the most developed country. So that is the scenario that we have. And on the other hand, with this COVID, so the scenario, and there is a altogether different environment we have to learn to live with. So coming back to digital health care in India, what has happened now, catering to this huge population and such a large number of beds in this country, digital health has been a critical need in this country for efficiency and effectiveness of healthcare, especially in diagnostics, treatment management, and outcomes. And then it's very much required for patient monitoring. And the change scenario, what we see, this NCDs, it requires further use of ICTs, this information and communication technologies using into that, and other digital portals. So this is what has happened, and we are looking at. I would like to say that digital technology is very, very important for countries like India, where we are required to reach large number of population and helping the healthcare providers in decision making, and using AI and machine learning in future to do diagnosis, treatment, management, and prediction of health outcomes as a consequence of the treatment. And then monitoring is a very important aspect, patient monitoring. Now the devices, this medical device industry has further come in, the technologies, digital technologies have come in, and it's being very effectively used. I can cite now 3 examples of digital technology which is being used, and those programs are basically managed using digital health technologies. Number 1 is this IIHMR Bharat. Might have heard, they have, in last 1 year, they have treated 10 million patients. And all this is based on digital technology. All communication, verification of patients, verification of IDs, and then linking them with the payment patterns of the hospitals. All this is based on digital technologies. So there is one big example of use of digital technology in healthcare. And the second is this MCTS, Mother-Child Health Tracking System. So we have millions of pregnant women and millions of babies are delivered. You will be surprised how they are monitored. They are monitored through digital monitoring systems, and the government of India and the state governments have records now of every pregnant woman, how the care is being delivered, and what are the outcomes of that. Whether it was a safe delivery or a complicated delivery, or whether mother survived, mother died, or what are the results of a verbal autopsy. That's the second great example how the whole country is linked up through the networks of digital technology and Internet of Things. And third great example is our COVID war. In the COVID times, you might have not realized, but digital technology is operational in a big way in collecting information about the patients who are affected with coronavirus, and then tracking their treatment, tracking their testing, and then communicating results of testing, and then putting patients in isolation, and then monitoring those patients, and then tracking of the contacts of the patients, and then putting people in quarantine and keeping their records. Now, how does this happen? It's so impressive. Once the patient is registered in a hospital, their phone numbers and Aadhaar card numbers are taken, and then within 1 hour, the coordinates of the patients and his contacts are traced, and they are advised what they have to do, and this is strictly monitored. So these nationwide 3 initiatives, which are driven by the digital technology today. Now, what is further required, the huge system that India has, if you want to bring efficiency and effectiveness of health information systems, of vast health systems in India, I think this is very important. This country has to move on to digital technology. We are already there. I would like to share with you, if you have any idea of National Health Mission. Now, this whole National Health Mission is monitored. Its progress is monitored through various digital platforms. We also have programs of teleconsultation. We have programs for telemedicine. We have programs for teleradiology and like that. The whole idea is to really address. Now the things have further complicated, that we have now big data available on personal information of people. You might have seen various apps that are integrated into the system, and how to do this big data analysis, interpret them, and then use in design of various treatment management protocols, and then monitor those patients. So using this data in decision making, monitoring patient outcomes is very, very important. So it's growing, and there is a need for developing integrated system and one digital platform where all this information is available. So we see a huge, huge opportunity in the coming time. And then we have program of Government of India, Digital India. So with this Digital India, is a big thrust to digitization of entire healthcare in this country. So these are my initial comments, but in future I'll be coming back if the moderators have any questions or you have any questions. Thank you very much. Shweta? Shweta? Nitin?
Yes, sir. Yes, sir.
कहाँ गए भाई सब लोग? श्वेता कहाँ गई?
देखता हूँ.
देखो वो तो respond नहीं कर रहे. I've done mine.
Prem, I think Dr. Shweta seems to be having some internet issues, perhaps. This is Dhananjay. Prem, if I could request,
Yeah, sure.
if I could request you to please introduce DayToDay, and as well as, please also define the context of our business and what we've been doing in the field of digital health transformation, please. Over to you, Prem.
Okay, thank you. Thank you.
अरे यार क्या करें यार इसी लेडी का यार.
I request everybody else to kindly mute their mics, please. Thank you.
Okay. Dhananjay, you want to start again?
Yes, please. So I'd request everyone, first of all, to kindly mute their mics if you haven't done it already. And I'd like to introduce Prem Sharma. Prem is our Chief Executive Officer of DayToDay. DayToDay is a company that's based out of Boston and Bangalore. We're a global digital healthcare company. I would request Prem to introduce DayToDay, the kind of work that we've been doing with hospital and our healthcare partners, as well as patients, and our own experience, our journey in the space in digital healthcare, as it relates to both at the government level as well as with hospitals and caregivers. Over to you, Prem.
Okay, thank you, Dhananjay. Good afternoon, everyone, and I'm glad to be part of this webinar and be part of this esteemed panel. So DayToDay is an digital first acute care management company. By digital first, we mean like we provide all our services using digital channels. By acute care, we mean is we help people in the episodes of the care where they need a lot of support, and most of these episodes happen pre and post hospitalization, where people have a lot of support, where people need a lot of support, but they don't have much, because when people are in the hospitals, they have hundreds of years of experiences supporting them. Once they leave for home, then there's a dip. There's a dip with a lot of confusion and a lot of needs, and those are the areas in which we help the patients. So I think the one of the question has been discussed on what is digital care and what it is bringing to what the changes we have seen after COVID in digital healthcare. So the one thing which we are observing now is since our journey for last 3 years is now digital healthcare. When it comes to tertiary care settings, it has become question of when, not if. When we started the journey, there was a big question mark, or if we need a digital healthcare for this part or not, if we need digital healthcare for patient experience improvement or not, what else can be done without using digital channels. But now all that debate is gone. Now it's question of when and how we can make it work. And there's a big shift we have seen ourselves when we are talking to healthcare providers across the world. Now they are a lot more open to discuss what the needs are. And I will define their needs into 3 different areas. So first area is efficiency. As people, we are in the time where because of COVID, we have lost a lot of efficiency. Doctors, people have to maintain social distancing, and they have to work under new norms. Working under new norms means that we cannot be as efficient as we were before. Now the question becomes is how do we use technology to give us back some of the efficiency we have lost? And one example of this is, previously we can admit people if they were not ready for a surgery for a longer period of time in the hospitals to prepare them to be procedure ready. Now, because there is a limited number of staff, we want to use it in the most efficient way so that patients spend the least amount of time in the hospital to avoid the infection instead of go to the procedure they need, which means now all the preparation work has to happen digitally outside the hospital. Second part is extending the reach. Extending the reach of the hospital means once people leave the hospital, how do we still give them the support they need? And it comes is in different needs, how do we keep people out for most of the healthcare needs? How we can supply those needs digitally? One example of this is post-surgery consultation. Do we need to send patient back to the hospital where there are chances, there's a risk of post-surgery of somebody catching infection, and can't we do this at home? Another example of extending the reach is required and dynamic nature of the problem we are facing. Like if you see what is happening with the COVID, we are constantly getting new procedures, new timelines, new ways to handle the COVID being communicated to us. A human system is hard to reconfigure that fast to deal with COVID and deal with the situation. So that's something which, what we have seen is digital solutions are helping hospitals a lot in constantly configuring it for changing needs. And another part is is improving the end-to-end patient experience, which fundamentally leads to better outcomes. Is these are the three areas where we have seen digital healthcare entering in the markets of secondary care. Dhananjay, what was your next question?
What has been our specific experience over these years with hospitals, with healthcare systems? And if you could give a perspective on one is as far as the hospital and hospital administrators are concerned. Second perspective is from the doctor's perspective. And the third, of course, is the patient's perspective. So if you could sort of give those three perspectives on how it impacts the experience.
Okay. So what we have seen is how people are using our solution in different geography. So the one thing which people are using us for is holistic care. Care needs are very complex and very, very holistic. Just to give an example, when somebody goes through a surgery, it's not only physical trauma, it's also psychological trauma, which means people also need to be managed psychologically. If somebody has any issues with specifically for, let's say, something like cancer, not only their medication has to be taken care of, their diet also has to be taken care of, their activities have to be taken care of. So lot of holistic needs, lot of holistic management is required. So that's one area where we have seen like a lot of people using this. Second part is pre-hospital care, which means how do we prepare patients for a procedure, post-hospital care. And then as Dr. Gupta was saying, is outcome management, is long-term care to track the patients over a period of time and making sure that they get the outcomes which they intended after a medical procedure. So these are three areas we have seen. Initially, what we have seen is there are things which where we have made a lot of impact. So I'll give you one example of somebody's infection control. So for complex surgeries, like let's say an example of open heart surgeries, people have 4 or 5 cuts in their body and their infection rates are very, very high. And those infection rates are a constituent of many variables. And those variables are how well controlled their sugar is, how they're taking care of their wound, how their wound is being managed and on day-to-day basis, how educated people are about to understand different life cycle of wounds. So that's like one example where what we have seen, if we provide holistic care, which is about how do they maintain their sugar, how do they take care of the wound, whatever the different aspects of care is required, what we have seen is that we can cut down the wound infections to almost like by 200 times. Where other areas we have seen is we have made a lot of impact is on the patient anxiety, because when people are at the home, they have a lot of questions, not only patients and patients' families also. So there is a patient anxiety, but there's also a caregiver anxiety, because caregivers are directly to the patients. They want to make sure that they are doing everything right to take care of the patient. But most caregivers are not educated to play that role. And while healthcare is focused on the patient, caregiver is also playing a big part in that care. So where we have also seen is like caregiver engagement is the area, like how do you educate, how do you empower caregivers, is something where we have made a lot of impact. For doctors, for the first time, they know exactly what's happening outside the hospital. Most of the healthcare recording of the information is focused around collecting the information from the patient within care settings. Even the electronic medical records and most of the hospital information systems are gathered around collecting the information while people are visiting the hospitals or getting any medical tests done. For the first time with DayToDay, we are tracking what's happening with the patients outside the hospital. So I'll give you one example in one area when we were working. So we were trying to learn that how a wound infection is created. So what is the journey? Like if a wound infection it looks bad on day 28, how it looked like on day 1 or day 15 or day 16, so that we can understand how an infection grows. And what we were surprised to understand that though there's a lot of data about infected images, there is very little data about how this infection has reached this point. So for the first time, with DayToDay, we are collecting the data which is longitudinal and which is progressive, which means this kind of data is very, very important for doctors, because not only they can intervene early, they can also understand that how can they change their protocols to capture wider needs. Using our system, for the first time, we have created a feedback loop for doctors' protocols. So they know if they're asking people to do something, are they able to do it or not? And if they are doing it, is it clear? What are they experiencing? So there's a feedback, ongoing, bi-directional communication going on about understanding of healthcare. So that's the area where we have seen we have made a huge impact for doctors. They are not relying upon patients' memories. They have all the information, whatever is required to manage the patients when they are visiting them, and also to track the patient on a long-term basis. And third part comes to administration. So administrations are looking to optimize the costs, improve the patient experience. So first part is we have seen is just because a patient is we guide the patient from 1 year from their surgery has been for 1 year from the surgery has been planned. So we help with the pre-post rehabilitation, all those different things. So if a patient is being handheld throughout the journey, what we have seen is the patient experience goes up. Based on the service deliveries, we have seen that most of the time when we are working with hospitals, we are able to improve their net promoter scores by at least 20%. And it's a big thing for hospitals, with something which is not only giving them a better word of mouth, but also better care outcomes. And also, hospitals are also able to provide new services. So for example, we can provide completely virtual rehabilitation services to engage patients for almost a year. This is something which was not possible without DayToDay, because most of the rehabilitation has been about the patient visiting the hospital and not managing them day to day. With our virtual rehabilitation, we engage the patients for much longer and we manage them in micro nudges on daily basis. With that, I will stop, and I'm happy to answer any other question you may have, Dhananjay.
Thank you, Prem. Just one really quick final one that I had is that can, you've really laid the landscape quite well. Can digital healthcare be used as a competitive tool or competitive advantage for a hospital? If you can just sort of quickly just, give us your perspective on that.
Yeah. So that's a very good question. Thank you for asking that. So what we have to understand, like, what is the role digital plays in any industry's evolution? Digital, most of the time, is something which is enabling information processing, information presentation, and communication to be much faster. Is one example of digital evolution is we can see from telehealth industry, where people were talking to doctors. Now they can talk to doctors using Zoom or like other apps and different channels. So which means like something which was already happening in physical world, we facilitated it to happen into digital world. Now that's an incremental evolution of what things which were already happening. We can enable it to happen in digital world. But digital also gives us so much more power to redefine business models, to do the things which were not possible before. So the kind of work we do is not really possible without having digital channels. So not only uh, digital is enabling the existing models, digital is giving the capability to hospitals to redefine new business models. So 1 year longitudinal day-to-day engagement pre and post surgery was something which is not possible if you think about all the aspects. How can it be holistic, how can it can be educational, how can it be personalized? These kind of solutions are not possible without digital channels. So what digital has done is twofold. A, it has made our current interactions more efficient and more available on other channels, like digital channels, support them, as well as creating new opportunities which were not really possible without digital. And DayToDay is an example of that.
Thank you so much, Mr. Prem, for sharing the wonderful insights. Now let me introduce one of our senior associates in Department of International Health at Johns Hopkins Bloomberg School of Health, Public Health, and our Dean Research at IIHMR University, and one of the very senior professors who is a specialist in health and public administration, Dr. D.K. Mangal. Requesting sir now to share your insights. So can you just unmute your mic?
Now I'm audible?
Yes, sir.
Yeah, good afternoon. And thank you very much. The digital technology has influenced the health sector in more than one way, and it has transformed the way the health services are organized at different levels. It has improved efficiency, and it has also greatly contributed to improve the outcomes of various health interventions across countries, across all levels. Now, we do have some evidences about this transformation, but I personally feel that more systematic way or approach is needed to document the evidence that digital health technologies improves the access to health services, improves efficiency, and improves health outcomes. There are a lot of opportunities, especially in mid-income countries or lower mid-income countries, where there are large number of health institutions, both in public sector and private sector. The numbers were shared by Dr. S.D. Gupta to begin with about India, when he said that about 700,000 hospital beds are in the private sector, and 900,000 beds in private sector, and 100,000 beds in the public sector. So it's a huge, huge infrastructure, and the patient load is also huge. We have, unfortunately, as we are passing through this epidemiological transition, we have both the disease burden related to the communicable diseases, nutrition or micronutrient deficiencies, and also the diseases related to the lifestyle of people. Now, what is required that we need to generate evidence that different way of offering, organizing health services using digital technology improves the efficiency, improves access to the healthcare, improves client satisfaction, and improves health outcomes. Currently, I'm not saying that it is not being done, it is done, but the work is fragmented because there are immense opportunities that has been created by digital health are not being used to to its maximum, I would say. Each hospital has the patient data. They have also electronic health records, but there is no sharing. There is no platforms where this data could be exchanged or utilized. Although the need for this was very well appreciated, especially in India, and when the health policy was revised in 2017, it was emphasized that a national digital health authority will be created in India, and the purpose of this authority was to facilitate the process of exchanging information both with all the stakeholders to improve efficiency, transparency, and outcomes. And it has emphasized that the data, the large amount of the data that is generated, both the metadata and the data standards and EHR will be supported through this policy. Some work has been done, but I still feel that a lot more could be done in this area, because, you know, I just want to emphasize the point that the health services are provided, and at that point of time, research is not in the mind. And people feel that research is a different activity or vertical activity. While if we are conscious of the fact that if we keep our records systematically and design the formats well, then perhaps this data, which is generated as a part of this process of providing services to the people, could be very effectively used for doing very meaningful research, whether it relates to testing the efficacy and feasibility of different options and interventions, or whether it relates to the treatment options and their efficiency and outcomes. So this is an enormous field where a lot more needs to be done.
Thank you, sir, for your great insights on this particular topic. Most of the attendants are students. So some of the students have asked how can they make a career in research in the area of public health? What exactly they should do in order to inculcate those skills so that they can do research in this area?
Now, the skill sets required for any professional who is interested in pursuing his or her career in research related to digital health or health sector per se, I would suggest that they need to learn several fundamental disciplines that are essential. And one of the important discipline is epidemiology. They must learn epidemiology, especially clinical epidemiology, if they want to work in the hospital sector. Then statistics, the skills in the statistical techniques is very, very important. And obviously, since they want to work in the health sector, so they need to develop their understanding of the health sector. So they need to learn the public health or hospital systems. And then research methodologies are very, very important that they need to understand. And since the focus is on the digital technology and its usage in health sector, perhaps some understanding on various digital techniques and tools that are used both in various applications of this digital health in health sector. It could be telehealth, or telemedicine, or it could be remote monitoring, it could be remote healthcare provision through use of automated machines or robots, or it could be digitalization of hospital processes, different processes. So the understanding of all these things is also require to have an overview of this field, and then basically or basic skills in research methods coupled with epidemiology would be very, very handy if they want to develop their career in this sector. The courses like MBA program in health and hospital offered by our university are very useful courses to prepare young graduates for this particular specialty, I would say.
Thank you, sir, for giving such a useful information to the students about careers and research in the area of digital health. Now, I would request Mr. Vishnu to share insights about making academic as well as, corporate career in the area of digital health. In order to introduce Vishnu, I would like to, share this particular PPT. Dr. Vishnu is an orthopedic and ballistic trauma surgeon. He's a seasoned healthcare manager turned healthcare entrepreneur. He has worked with Aditya Birla, Apollo Hospitals, Fortis Healthcare, and United Nations Support Office for Africa. He has more than 2 decades of experience in healthcare management, strategy, PNL, clinical operations, and digital healthcare. He has done his MBA from Massachusetts Institute of Technology and Sloan School of Management. He has a dual degree in artificial science and a master's in business administration. He specializes in care management, analytics, healthcare operations research, IoT, artificial intelligence, and blockchain. Dr. Vishnu?
Yeah. Thanks for inviting us to this eminent panel. We have a lot of IIHMR students working with us as interns, so I have a lot of interaction with them, and let me tell that they're like wonderful people. So I thank IIHMR for choosing such good people and also training them so well. So a lot of IIHMRs are working in our company on various projects, their dissertations, and all the many things which we are coming up with. Yeah. So can you repeat, like, what was your question?
Okay. So most of the students would like to know how can they make a career in digital health, especially in product space. There are a lot of companies which are working on products in digital health, and most of the MBA students, as well as students who don't have a tech career but have a either BDS or MBBS career, would like to get into the product management or product innovation. How can they do that?
Yeah. Let me quote you a live example. See, 2 months back, if you go to the month of February, January, nobody in India was knowing that there will be a lockdown, and we're all going around our businesses, work as usual. And suddenly there is a huge lockdown for like 2 months. The whole world has changed around us. So 3 months back, if somebody had asked, like, what is a COVID or what is a coronavirus, people hardly had any information, though coronavirus has been in existence since last 2 decades. So now the corona is the talk of the world. So in last 2 months, we in DayToDay, we developed an industrial COVID product and also a COVID product, a digital product for the governments. So what do we call as an industrial COVID product? See, now after the lockdown, a lot of industries are opening. If you see, they were locked down for 2 months, and now industry is opening. So what happens if a person who is a COVID positive or else who is suffering from COVID goes and starts working? So he will infect it to others. So companies have to take care of that. They should ensure that nobody enters the industry who is positive. But how do I know that I'm positive? Because many times, if you see 30 to 35% of COVID patients don't have any symptoms. So I might be COVID infected, but I don't know. I don't have fever, cough, or anything. So I might just go into the company and start working. So, but we developed an algorithm which can detect that before the, if an employee takes that screening test and algorithm and we have other clinical parameters through which we diagnose if you have any risk for having positive COVID. And we give that information to the HR before any person starts working. And if there is a high risk, then they can prevent that person from entering the company, and then thereby prevent spreading of the infection. If you see a lot of news, there are a lot of companies who are getting closed because some people got infected. Like 2 days back, there was an infection that Oppo, the manufacturing company of phones, got closed for a month because like 9 people were infected inside the company. So this we developed in like very few weeks because before that there was no need of such a product. So what goes into this product? How do we come up with a product like this? So we have 3 kinds of people who work on this kind of thing. One is product managers, who second are the tech people, and third people are the clinical experts. So they both have 3 people have to work simultaneously together as a team to build a product like this. Health tech is totally different from other digital technology because there is a lot of domain expertise that is needed in building health techs. So if I'm building an automated robot or an app which works for anything else other than health, you don't need the domain expertise. I don't need to be knowing that. But in health tech, there need to be a lot of clinical expertise. So usually what happens in the education system is engineers are educated to be in engineers, doctors and healthcare workforce is educated to be in medicine. And so they don't mix with each other. So if I'm a doctor, I would never have studied anything about engineering or product development, and an engineer would never know what is basics of healthcare. So this bringing to these 2 kinds of people is what a health tech industry does, and that's the most difficult part of it. So we have interns from IIHMR who have worked on this product, and there were engineers, some of them were doctors, some of them were so they all work together and each bring their own expertise. So now coming back to what should people do to go to a digital health tech field instead of going and working in a hospital. So 2 things are needed. One, your basic core clinical expertise. If like I see a lot of dentists or doctors doing MBAs, that's one part. So you have that core clinical expertise. And second is the other knowledge which is needed to build products, like how to think through system, like how do you sort this problem through a process, or how do you sort this problem through a system. So that thinking is what is needed to build a product. So do schools teach this? Do our education teach this? Is a big question mark. But it usually comes through working in an industry. So if you want to choose this field, so I would suggest students, when they do the summer internship, to usually intern with companies like DayToDay or digital health tech companies, where they're working in teams with both healthcare and product and engineers, so that they know like how to think system-wise, how to think from the perspective of a system or a product. And your clinical expertise would be a great advantage for it if you develop these 2 skills. And as Professor Mangal was saying, you also need 3 basic things. One is a strong hold on the epidemiology, because most of the things which we work is based on clinical epidemiology. And the other 2 things are a strong base in statistics and research methodology, because mostly you have to come up with things which are not there in the market, or so you have to do a lot of research. If you ask any of our interns, they would have done so much of research, read so much of literature, so much of papers. So you should know how to research on the new things, how to come up with the insight, reading all those things. So these are usually taught in subjects like research methodology. So if you have focus on that, so try doing this, try interning with a health tech company, and then develop your skills in these 3 subjects, and also learn about what is happening in the technical health tech field, like what are the new things that are coming up. And another thing which I usually get from people is like AI and machine learning and NLP. These are the kind of questions people ask, like, I want to work in AI. But I would say that AI, most of the things which people claim as AI is mostly a fad. So there's no AI in that. They would be doing some very minimal thing as digitization.
Thank you, Dr. Vishnu, for your great insights about how to make a career in digital health. Now, I would like to request Dr. S.D. Gupta, sir, to give insights on how we can make a foray in digital health, especially for the base of the pyramid, where the quality of the service of the health services is especially very poor.
Thank you, Shweta. Can you hear me?
Yes, sir.
Okay. So basically, the challenge is we get a lot of data from the health or point of service in the system. And what we find, usually this is quantitative information that we get. So it's important that what are our information needs? Are we getting the information that we need? Are we getting information what we want? Is the information usable? And can we use this information for our decision making? These are some of the issues that need to be addressed. Now we have a very elaborate monitoring system or health information system, I would say, in National Health Mission. So we find that, say, for example, one of the indicators is antenatal care. How many pregnant women are registered in the first 12 weeks? Now, one is how many women are registered during pregnancy, but the quality indicator is how many are registered within 12 weeks of pregnancy. Because the earlier they are registered, we can start with interventions and promotion of health. So it's not only the number of antenatal care visits, but also the content of service that is delivered to them and at what stage they are. So this data need to be interpreted. So it is important that the system capture the information what is required. So right data, timely data, complete data, accurate data is very, very important. That is one. Second, the flow of information, a timely flow of information upwards towards the program managers, and then for the policymakers at the national level. And then a reverse feedback loop about the gaps or what are the areas where the improvements are required. So it's a continuous process. This data tells you what are the gaps between the standards that we have decided to be achieved or maintained, and what are the gaps we measure by using various indicators. And these indicators are derived from the data that is available to us from the system, from the point of service health facility. So then it is compiled and decisions are made. But it is a continuous process. So the gaps are identified if we have right information system and correct information we collect and properly and timely analyze and give feedback for improvement. So data is very, very important. Today, healthcare is data driven. And I would like to say particularly about doctors. Out of four speakers, we three are doctors. And we are exceptional in the sense that we don't fear data. But most of the doctors fear data, and this data analysis skills are so necessary. So one should not be fearful of data. Doctors are particularly of that type. And second, in timely interpretation of this information and giving feedback for bridging the gaps through the solutions. Now, what are the solutions? Now, these solutions, now this whole platform has to be based on digital technologies. Now, you know, this mobile technology is also very profusely used. We ourselves used AI sort of algorithms for mental health care in the rural areas. So a lot of things can be done, and the quality definitely can be improved if we have the right data, timely data, and the interpretation is done at the right levels, and then the decisions are given, and inputs in the policies are provided from these gaps. So this is how we can work on this continuous cycle of improvement of quality of services using information. This is very critical for quality improvement of services.
Thank you, sir, for giving wonderful insights on how we can cater to bottom of the pyramid. Now I would request Mr. Prem Sharma, CEO of DayToDay, to give his insights on how students as well as the faculty can develop their skills in this COVID-19. What are the major skill sets? One thing that Dr. Vishnu talked about is the epidemiology, biostats, and the research methods. What do you think from the digital health product perspectives? What are the other skill sets that they need to develop in this COVID-19 era, and how they can do that?
Okay. So my background is in healthcare product management, and I am not a healthcare qualified person, which means like I'm not a doctor, nurse, or I haven't done any usual qualification in healthcare. So my way of learning has been twofold. One part is you have to think very, very critically, very, very deeply. If something is happening, why it is happening. What I have learned is like any other industry in healthcare, a lot of things happen because they have been happening like that for a very, very long time. And I can write like a book about, you know, my encounters where I saw things happening just because they have been happening like that for decades. So this is one part. Like, you have to be a critical thinker. You have to question why it is happening. Having done that, you will also get a lot of pushback from what you say, like, you know, existing people, like, you know, okay, this is healthcare, this is how it operates and everything. So you also have to be firm with your views, and you have to be confident on your track. So being critical really helps. Being a deep thinker helps. Being confident and while, like, you know, you are willing to learn, but also be willing to challenge is something which also really helps. And another part is the something which you know, I think is must for any product person is having good observation skills and good empathy, which comes hand to hand. If you're not empathetic with people, it cannot be very good at observing them. So empathy with the users, with the patient, with the doctors takes you very, very far. Most of the product I have built, my skill set revolves around these things, because these skill sets are the meta skill sets on which you can build harder skills. You can learn harder skills, but until unless you have the framework of meta skill sets, it's very hard to put them in execution.
Thank you, Mr. Prem. I would like to request Dr. D.K. Mangal to give insights on how exactly academia and corporate can interact and collaborate on doing research.
Well, Sweta, I think when you are referring to corporate, I can construe it both the corporate hospitals in private sector, and also the other fields related to health, like pharmaceuticals, or the corporates, companies who are dealing with healthcare devices, diagnostics, etc., etc. Now, basically, cooperation is essential. It's not optional, because the services being offered in the hospitals and healthcare services require various tools and techniques, starting from diagnostic to patient care and health interventions and services. And therefore, if we are interested in learning more or documenting all aspects of this healthcare, whether it relates to efficiency, or whether it relates to client satisfaction, or whether it relates to the outcomes of those interventions, the cooperation between these sectors is essential. Dr. S.D. Gupta referred to the lot of potential of this research that could be done, because during the transaction of these services, there are opportunities to generate data and record this data in real time. And then later, this data could be used in different ways for further analysis to understand the aspects of the efficiency, efficacy, effectiveness, and satisfaction. But the point is, and that this is a very important point, and we need to understand this, that the data that is currently being generated at the point of transaction of the service, or at the point of interaction of the service seeker or the client and the service provider, whether they are in public sector or private sector, that data is primarily generated from the point of view of delivering that service. The research is not in mind at that point of time. And I think this is the point that I want to underline, that we should be mindful of research also while designing this data that we capture during delivery of routine transaction of business in healthcare settings. One of the important drawbacks of the existing data that is huge, but there are big gaps in that data. It is not very meticulously recorded and reported. Different people who are responsible for recording this information, they are not serious enough. And therefore, this huge amount of data and this big opportunity of routine transaction of services and capturing data remains underutilized or is not good enough to be utilized from the point of view of research. Therefore, I would urge that we should look into the processes, current processes, and the data needs that have been identified from the perspective of research, and we should redesign these processes using the digital technology. And digital technology can play very, very important role in improving the quality, completeness, validity of this data, one. And secondly, we need to come to a consensus that how this metadata can be shared between different setups and researchers, so that ultimately this could be put to use and we come up with new knowledge and new evidences about efficiency, efficacy, and other aspects of health outcomes. Shweta.
Thank you, sir. I would like
Dr. Shweta, if I could request you to wrap up because there is another meeting coming up now.
Sure. I would
Thank you.
like to thank all the attendees and panelists, especially Dr. S.D. Gupta, Dr. D.K. Mangal, Mr. Prem Sharma, and Dr. Vishnu for giving precious times and really exceptional inputs about digital healthcare transformation in hospitals. Last but not the least, I would like to thank marketing team, IT team, and other staff from DayToDay and IIHMR for making this webinar a success, and apologize for the delay in starting it. Thank you. Wish you all the best and have a good day.
Thank you, everybody.
Thank you.
Thank you,
Thank
Dr.
you.
Shah.
Thank you
you.
very much. Thank you,
Thank you.
Dr. Vishnu.
Thank you.